now we are going to look at some of the most important clinical findings related to different disease and the high yield points storage for protein, fat, and carbohydrate. Which hormone has this function? That hormone is insulin. Insulin has a function of storage of protein, carbohydrate, and other um, organic and inorganic compounds like fat, protein, carbohydrates. Ketogenesis is performed by insulin, and insulin also helps in potassium influx into the cell. It occurs in insulin deficiency. Ketoacidosis occurs, and that results into fruity breath, and the patient will have acidotic condition. Inhibition of hormone sensitive lipase will be because of insulin. It inhibits hormone sensitive lipase. Insulin has also role on growth hormone, and there is no any other effect but insulin. In growth hormone excess acromegaly, there will be deficiency of insulin, and patient will have increased glucose concentration. Decreased release of growth hormone because of somatostatin. It inhibits growth hormone, acts on anterior pituitary gland, and decrease release of growth hormone. Somatostatin acts on anterior pituitary gland. As we know the anatomy of pituitary gland, there is anterior pituitary gland and another posterior pituitary gland. Anterior pituitary releases FSH and other hormones like growth hormone, and posterior pituitary release oxytocin and ADH. So in this way, pituitary gland having decreased growth hormone because of somatostatin. Inhibition of anterior pituitary hormone because of somatostatin, that inhibits release of growth hormone, and it is somatostatin which also potent inhibitor of insulin release. It decreases pancreatic secretions and acts on in pancreatic secretion. Beta cells are there that are paracrine cells which release insulin, and somatostatin inhibits insulin release. So in this way, insulin and growth hormone release is inhibited by somatostatin. Growth hormone before puberty. Immunostimulatory hormone is also growth hormone which stimulates immune receptors, immune response. In fetal brain maturity, there is role of thyroid gland. Deficiency of thyroid gland in fetal life results into cretinism, and brain maturity has also linkage with fetal brain maturity. Anabolic on protein and catabolic on fat as growth hormone. So in this way, there is a role of growth hormone and other hormones on different metabolic actions of the body.